Hello, everybody. It's Hamid. I'm a PhD student of industrial engineering. My research area about data analytics and big data. And today I'm going to present two applications of that. One in transportation, another one in healthcare. Look at this. I'm sure maybe in your research or maybe you had some job experience, you go somewhere and a bunch of data represent to you. And what you can get from that data? Nothing, almost nothing. You just see so many variables, so many data, but and we can't conclude anything. For example, it's a data of a safety project in Michigan. They wanted to improve safety of pedestrians and bicyclists, but with this data, they couldn't end up getting anything. But if I give you a table, for example, looking at this table, you can see, for example, there is a city named Flint in Michigan, which rate of crash for pedestrian and bike is more than the rest of the cities. But why and where, which places in Flint? So even at this point, it's not enough. It's just some general descriptions. Okay, now we look at, for example, pedestrian crashes in those four cities. We can see some part of the cities, you have more crashes. So far, we understood which city is the worst, which city is the best, and what is the problematic area for pedestrians. Okay, maybe there's some reason for that. We look at, for example, here, pedestrian exposure or pedestrian traffic. If you look back to the previous one, you can see somewhere that you have more crash, you have more pedestrian, which makes sense. It's kind of intuitive. What about traffic? I mean, the car traffic or average daily traffic. It's kind of look like similar pattern, but not exactly. But generally speaking, we can find some correlation between traffic of pedestrian and cars to the crashes. Okay, maybe instead of in addition to those things, there's some other variables like geometric data, having parking near intersections, or some signs, some information. Okay, so there's some kind of modeling in the statistics. They call it predictive modeling. Getting those data and finding those data that we think is good and putting in some modeling. And here I made a model which I could predict number of pedestrian crashes at intersection in those four cities. But it's research part. What's the applications? I found, for example, here there's 7 variables increasing or decreasing the crashes. Okay, for example, here I said traffic, bike volume, number of those things related to crashes, but they can't do anything with that. But there's something else, like number of bus stops, a speed sign, parking near intersections, number of left turn lane. It means, for example, if you're, the guy who's responsible for safety of pedestrian or bike crashes there, you see, okay, I have some problematic points, some problematic intersections. If it is, and I want to reduce the number of crashes, let's take out the bus stop near the intersections. Or let's take out the street parking near the intersections. So it's the application of, this kind of modeling. Maybe it's not very interesting for you to exactly predict number of, crashes there. But what you need is how you improve the safety. And this kind of model gives you that. And also, you can maybe look at more in details about how variables are related to each other. For example, here I'm saying bike lane is related to bike volume. Or maybe ADT, in some cities we have more traffics. So just finding some causal relationship among variables. For example, in bike models, having bike lanes means you have more bike crashes. So if bike lane is good or bad, if you have more bike lanes. If you have bike lane, at the same time you increase bike volume at the intersections. So although your number of crashes may increase at that intersection, but the crash per bike traffic will decrease. So having bike lane doesn't mean that you endanger the safety. Okay, here another application is healthcare application. You know, it's my website that I made an app. You can even go there and check those data with yourself. You know, look at those yellow points. You know, it means in some places you have more obesity in that region, which is northwest of Florida. Or in some places, you know, maybe those, obesity or thing related to other factors. Look at the printed page that I put on your tables. You know, as you see, you know, there's two kind of, problems there, and you have some hospitals. But, you know, look at the hospitals. You know, they are not close to the most problematic areas. It means maybe the investment has a problem, or maybe if they want to invest more in those areas, it's better to move their hospitals somewhere close to those problematic area. So data visualization would help. People who's make a policy there, how to invest in their future. You know, same as crashes for the healthcare, maybe it's related to other factors. It could be socio-economical data. For example, here, we understood in the places that people have less access to, fresh food, and they don't have a car, it's kind of related to the obesity problem. It means they may consume more processed food. So even in these cases, you can understand some factors, how they are related. Or it could be cancer, and we can also look at this in, based on, the time. Look at this video. You know, it shows how cancer moves in northwest of Florida in 5 years. It should have a reason, and let's look back. I play you again. You know, the density of cancers moves during some years. It means something happened, and people can look at there and find the problems, what the location of cancers moves from left to right, or some other kind of diseases, which all of them is available in that application. Okay, any question?
Thank you. We don't have time for questions.